Good morning, everyone. Oh, let's try that one more time. It's Friday. It's sunny outside. Good morning, everyone. All right. Well, that's a good way to begin. I want to welcome you all to the Health Disparities Roundtable on building safe and healthy communities for all. I'm John Finnegan. I'm the Dean of the School of Public Health right here at the U. And I want to welcome all of you back here. I think this is, if I recall, Rhonda, Kathleen, our 12th year? Yeah, something like that, 12 years, yes. I know it dates from about the time I became dean. And every year, this is one of the events that brings in the largest number of folks from across the community. So we really appreciate having you here. So a couple of things I'll tell you at the beginning here and then kind of launch into an introduction. One is that we are taping this, and it's not being live streamed, but it is being taped, and so it will be available for people to see online in the near future. And the reason I'm telling you this is so that you can adjust your behavior accordingly, because it will be there permanently. And then the second thing is that if you've got a phone like I do that plays Beethoven or other noisy kinds of things, if the phone rings, you might want to put that on vibrate right about now. And I know that your speakers and your discussants will certainly appreciate that. Well, as I mentioned, for many of you, this is a return visit, and we want to say welcome back. And to those of you that are attending for the very first time, I'm pretty confident that you are going to find this to be a very worthwhile and I hope provocative discussion about this very important issue. So I think what you'll find is stimulating ideas. I think you will find this thought-provoking, and I think that you will come away from this with the ability to think about equity in a different frame of reference. And the frame is building safe and healthy communities for all. One might even say that is a prerequisite in many ways for equity. So if you Google building safe and healthy communities, you should I did this yesterday, so you should come up with about 19.1 million hits across the board. I know some are going, yeah, well, let's see if he's right, 19.1 million. No, it's 19.2 million, okay. If you look deeper into that, what you will find is about 292,000 recent news stories. You will find 118,000 videos, and you will find about 28,900 books, not to mention the millions of websites that are out there that are either focused specifically on this topic or that discuss this topic as part of their daily interests. So the point is that this is really a burgeoning social movement, in my view, that is engaging people, organizations, institutions, and most importantly, communities themselves. And so finally, perhaps, we might even go so far as to say we have some evidence that the narrative of what creates health is truly changing. Here's a good example. This is what the Surgeon General's website says. Health and wellness are influenced by the places in which people live, learn, work, and play. Communities, including homes, schools, public spaces, and work sites, can be transformed to support well-being and making healthy choices easy and affordable. Healthy and safe community environments include those with clean air and water, affordable and secure housing, sustainability, and economically vital neighborhoods, including efficient transportation, good schools, and supportive structures, and violence-free places to be active, access to affordable, healthy foods, streetscapes that are designed to prevent injury, and so on. Robert Wood Johnson Foundation, focusing very much on the development of a culture of health in the United States. Here's what they say. In the places where we live, many of us are surrounded by the essential ingredients in a healthy life, such as adequate housing and public transportation, quality health care, and safe places to exercise and play. And many of us are not surrounded by those essential ingredients. So what does safe and healthy mean to different communities? What's the evidence for promising strategies and practices for optimal health and safety for everyone? And perhaps, where does the accountability lie in moving these things forward? So today is a day of sharing our collective evidence, our insights, and our perspectives as we attempt to more fully understand and seek effective, sustainable solutions to this very urgent topic. So get ready for a robust discussion. An event like this takes time and teamwork to plan and deliver, and I do want to acknowledge the work of the organizing committee of faculty, staff, and students from the School of Public Health Equity Work Group, and also the medical school program in health disparities research. I also want to acknowledge the sponsorship of the Center for Leadership in Education in Maternal and Child Public Health, the Midwest Center for Lifelong Learning in Public Health, and the Region 5 Public Health Training Center. So please, a round of applause for our sponsors, our students, and our faculty planning committee. And it is now my pleasure to introduce to you the moderator of today's session, Ed Getz. He is the director of the Center for Urban and Regional Affairs, and he's professor of urban planning at the Humphrey School of Public Affairs here at the U. He specializes in housing and local community development and how issues of race and poverty affect housing policy, planning, and development. His most recent books are New Deal Ruins, Race, Economic Justice, and Public Housing Policy from Cornell University Press, and also Clearing the Way, Deconcentrating the Poor in Urban America. And that book, some years ago, won the Paul Davidoff Award from the Association of Collegiate Schools of Planning in 2005. And he has a forthcoming book, The One-Way Street of Integration, Housing and the Pursuit of Racial Justice in American Cities, and that is going to be published by Cornell University Press. And there's our hashtag, SPH Roundtable. You can tweet while we're doing this. Ladies and gentlemen, a warm welcome to Professor Ed Getz.
Thank you very much, Dean Finnegan. I'm really quite pleased to have been asked to be the moderator for today's roundtable. As someone whose teaching and research focuses on communities, I'm looking forward to what I'm sure will be a very interesting, informative, and an important roundtable. And so let me say a few things about how the morning is going to go, or how I hope it's going to go. We have three excellent speakers for you this morning, and they will each speak for about 20 minutes each. Then there will be a single question and answer period afterwards where the three speakers will be sitting up there. So during their talks, you can jot down on the index cards that you have in your packet any questions that you have. There will be student volunteers that you can pass the questions to. Our two volunteers are Hannah and Anna. That was not planned, I think. And so you can hand them your questions. But we'll also have a microphone that will be two microphones that will be available to people to ask questions after the talks and during the Q&A. So And we'll go until close to noon, and then we'll wrap it up at that point. So that's the plan. I'm going to begin by introducing the three speakers, giving you their brief bios, and then they'll proceed with their presentations. Our first speaker today is Mary Lee. Mary Lee is the Deputy Director at PolicyLink and helps guide the PolicyLink Center for Health Equity and Place. She provides technical assistance and training to public and private agencies collaborating to build healthy communities. She's a graduate of Bolt Hall School of Law at the University of California, Berkeley, and she is a practicing attorney with more than 25 years of experience using civil rights, land use, and economic development strategies to revitalize neighborhoods and enhance public participation in the policy arena. At PolicyLink, she has co-authored reports on access to healthy food, the built environment, the impact of place and race on health. She also teaches courses on law, public policy, and civil rights. Mary stays true to her motto, which is think globally, act locally, by remaining active in local politics in Los Angeles. Our second speaker today is Luz Maria Frias, who serves as the president and CEO of the YWCA in Minneapolis. The mission of the YWCA Minneapolis is eliminating racism, empowering women and girls, and promoting peace, justice, freedom, and dignity for all. She previously served as the vice president of community impact for the Minneapolis Foundation, where she oversaw the foundation's competitive grant making and provided strategic direction and leadership for the foundation's community development initiatives. She is an experienced lawyer and mediator and frequent lecturer on the issues of race equity, implicit bias, and diversity within the legal system. Ms. Frias can be heard regularly on Counter Stories, which is a Minnesota public radio podcast that addresses current issues in our community through a race equity lens. And our final speaker today is Chanda Smith-Baker. Chanda Smith-Baker serves as the president and CEO of Pillsbury United Communities. Ms. Baker is responsible for the operations of 5 neighborhood centers, a training center, and 8 social enterprises. Ms. Baker leads with an unwavering focus on closing racial disparities and measuring outcomes, boldly pushing the agency to become more focused, more creative, and to include the voice of communities in its solutions. In 2014, she led a planning process that resulted in a new strategic framework called One Pillsbury United, our plan for creating thriving communities, to further the agency's impact and its operational capacity. So we have 3 very dynamic speakers today. We look forward to their presentations, and without any further ado, please welcome Mary Lee.